Hello, good morning students. Myself Lija ma'am. Welcome back to our community health nursing. Today we are going to study the topic National Population Policy. So last day we have started with our new unit. Already we have discussed about the health problems, various health problems in India. Today we are going to study National Population Policy. By hearing this topic itself, I hope you all will be able to understand what will be the objective or what will be the main aim of this particular policy. Yes, of course, in order to reduce the population or in order to concentrate the goals and objectives related with demography. Because I have told India is having a fast or a rapid increase in its population. So through various policies or through direct or indirect rules and regulations, it is the duty of government to control the population in a particular limit. So let us see through this policy what all things government is aiming at and what all have been achieved. So population policy in general, it refers to policies intended to decrease the birth rate or the population growth rate. As I have told, in a general or generally we can tell what is population policy means. These are the policies which are intended in order to decrease the birth rate, otherwise to decrease the population growth rate. In April 1976, India has formed its first national population policy. It is called for an increase in the legal age of marriage among the females and males. So we all know that till 1976, the age for marriage for females was 15 and the age for males was 18. By April 1976 onwards, through the national population policy, that means the first part, this population policy has taken its first step by increasing the legal age of marriage for both females and males. So females, they have set as 18 years and for males they have set as minimum 21 years. And in the same year, the statement became irrelevant and the policy was modified in 1977. So with a minor changes, later they have remodified the same policy with the same objectives. The policy statement retreated the importance of the small family norm, that is, which is very highly related with family welfare program. So this program was really highlighting, or it was retreated. That means the same thing was again given the importance of small family norm, because we all know that it has its own various slogans. We have already studied the small family norm under the second unit. That means the unit related with the family as a community part. So in that we have discussed about small family norm. So they were giving importance for family welfare program. So the National Health Policy approved by the Parliament in 1983 had set the long-term demographic goal of achieving a net reproduction rate of 1 by 2000. See, by 2000 actually the National Health Policy, they have set in 1983 that we should be able to, that means India should be able to attain its demographic goal as the reproductive rate should be 1 by 2000. But do you think that it has been achieved? No, never. Net reproduction rate 1 ആക്കണം 2000 കൂടി എന്ന ഉദ്ദേശത്തിൽ നാഷണൽ ഹെൽത്ത് പോളിസി 1983 അപ്രൂവ് ചെയ്തിട്ടുള്ളതാണ്, അതിൻ്റെ ഒരു ലോങ് ടേം ഡെമോഗ്രഫിക് ഗോൾ. ബട്ട് അൺഫോർച്ചുനേറ്റ്ലി ഇറ്റ് ഹാസ് നോട്ട് ബീൻ അച്ചീവ്ഡ് ബിക്കോസ് it is not only in the hand of government, it is not only through many rules and regulations. There are so much of other things like community participation, the cultural factors, the couple they have to be also motivated towards the growth of the country. If all these things merge together, then only we will be able to attain the proper reproductive rate of our country. Like we can tell about the national population policy in many sense, like the measures formulated by a range of social institutions including government, which may influence the size, distribution and composition of human population. So we all know that what is population policy. National population policy means it is a set of rules, or it is various measures formulated by a range of social institutions. That means by the government, they have taken so much of measures in order to influence the size, distribution and composition of human population. Otherwise we can tell a deliberate effort by the national government to influence the demographic variables like fertility, mortality and migration. See, through population policy they are mainly influencing the goals, or mainly they are influencing the variables like fertility. That's what we were telling, the net fertility rate or the net reproductive rate, controlling that, and the mortality issues of a mother as well as the child, which may stable the family size, and migration issues. What is migration? I hope you all know what is migration. Yes, the social mobility, or movement of people from one place to another, so from one country to another. So they are migrating from one place, from rural to urban, otherwise from one state to another state, or from one country to another country. So migration issues, these all will actually influence the population composition of a particular country: fertility, mortality and migration. Otherwise we can tell a set of coordinated laws aimed at reaching some demographical goals. This is what is known as a national population policy. അപ്പോൾ നാഷണൽ പോപ്പുലേഷൻ പോളിസി എന്താണ് എന്ന് വെച്ച് കഴിഞ്ഞിട്ടുണ്ടെങ്കിൽ നമുക്ക് ഈ 3 കാര്യങ്ങളോടുകൂടി നമുക്കതിനെ നല്ല രീതിയിൽ ഡിഫൈൻ ചെയ്യാനായിട്ട് സാധിക്കുന്നുണ്ട്. One thing is we can tell these are various measures taken by a range of social institutions which include the government in order to influence the size, distribution, composition of human population. Otherwise we can tell it is the effort of the national government in order to influence the demographic variables like fertility, mortality and migration. Otherwise we can tell it's a set of coordinated laws, otherwise rules and regulations aimed at reaching some demographic goals. So these are the various we can tell various aspects, or we can tell various outlooks of national population policy. So let us see what was the aims. They had short term aim, medium term and long term. So let us see in the national population policy 2000 India, what all they have aimed as a short term. So as a short term they have aimed at fulfill unmet need for contraception, strengthening the health infrastructure, integrating the services of reproductive and child health. As I have told, like reproduction and child health is one of the major aspect in order to decrease the population. Because see, if the people are more good and healthier in the reproduction, and if the child is having a very good health in the younger year as well as in the growing year, we can, in one side we can control the population. Because the secondary thought, or the again the secondary thought of the population can be blocked through a proper health of their first or second child, or by the health of a mother. So we have to motivate the people to think about how to restrict the multiple pregnancies, or how to restrict the frequent deliveries without any spacing. All these things should be emphasized. So they have emphasized on the use of contraception. They have emphasized on strengthening the health infrastructure, so that all the tubectomy, vasectomy, all these things the government has made it free through the public sector. So these all were the short term goals related with the national population policy. The middle term goal or the medium terms were effective implementation of inter-sector strategies to substantial reduction of total fertility rate by 2010. So by they have aimed, when they have made the policy, like when they have amended അല്ലെങ്കിൽ ഒന്നും കൂടെ അവർ അമെൻഡ് ചെയ്തു 2000. So during that time they have said that at least by 2010 they should be able to see a substantial reduction in the total fertility rate. So that was their medium term, and the long term objective was to sustain the economical growth, social development, and eco conservation, and the stabilize the population by 2045. Because see, when they have set many things for like 2000, it was not able to achieve. 2010 again, it was not able to achieve that much how they planned, but improvement was really seen. So they have set a long term also along with that. So long term we are going to look ahead അല്ലേ 2045 കൂടി അറ്റ്ലീസ്റ്റ് നമ്മുടെ പോപ്പുലേഷൻ്റെ ആ ഒരു ഗ്രോത്ത് ഒന്ന് സ്റ്റെബിലൈസ് ചെയ്യുക. സോ ദാറ്റ് ദർ വിൽ ബി എ സ്റ്റെബിലിറ്റി ഇൻ ദ എ ഗ്രാജുവൽ ഗ്രോത്ത് ഓൺലി ഷുഡ് ഹാപ്പൻ. എ സ്റ്റെബിലിറ്റി we should be able to see. There should not be a sudden rise in the population, or there should not be any population explosion, at least by 2045. Along with that, the government aims to have a long-term objective as economical growth. If the people are having a good economical growth, and if they have a good social development, and if they need a eco conservation, that means they have to be more living with nature. They have to be more eco-friendly. They have to reduce the pollutions like air pollution, water pollution. Everything is contaminated nowadays. The air, water, soil, whatever we are eating, whatever we are drinking, whatever food we consume. Even if we able to agriculture in our own land, we are not 100% safe because of the use of fertilizers or insecticides. Even though we are not using also, the other people, those who really use, when the flood comes or when there is heavy rainfall, we know that the composition of the soil may change. So from the nearby places it reach into your area. So we cannot believe anything nowadays. Even the vegetables we eat, fruits, everything is contaminated. So we should be able to conserve our ecosystem. That is very very important. See, when we conserve our ecosystem, and when we develop our socially, and when we develop economically, of course we can able to stabilize the population by 2045. So ultimately, if we stabilize the population, all the other thing also will automatically come in order, because it is all a cycle. It is all a chain reaction, we can tell. It's all in a form of cycle അല്ലേ. ഓട്ടോമാറ്റിക്കലി നമ്മൾ നേച്ചറുമായി ഇണങ്ങി ജീവിക്കുക, അല്ലെങ്കിൽ സോഷ്യൽ ഡെവലപ്മെൻറ്റിന് വേണ്ടി നമ്മൾ സ്ട്രഗിൾ ചെയ്യുക, അല്ലെങ്കിൽ ആസ് എ സിറ്റിസൺ ഇഫ് വി തിങ്ക് അബൌട്ട് ദ കൺട്രി ഡെവലപ്മെൻറ്റ്, സോഷ്യൽ ഡെവലപ്മെൻറ്റ്, ഓർ ദ ഇക്കണോമിക്കൽ ഗ്രോത്ത് ഓഫ് ഇൻഡിവിജ്വൽ ആൻഡ് ഫാമിലി ആൻഡ് കമ്മ്യൂണിറ്റി ആൻഡ് ദ ഹോൾ നേഷൻ, of course we can stabilize the population by 2045, which was a long-term objective. Then let us see the types of population policies. So when we set a population policy, usually they set in two types. One is explicit and next is implicit. ഒന്നുമില്ല, എക്സ്പ്ലിസിറ്റ് എന്ന് പറഞ്ഞിട്ടുണ്ടെങ്കിൽ ഡയറക്റ്റ് ആയിട്ടുള്ള ഡോക്യുമെൻറ്റേഷൻ ആയിരിക്കും പോപ്പുലേഷനെ കൺട്രോൾ ചെയ്യാനായിട്ട്. അതായത് നമുക്കിപ്പോൾ കാണാൻ പറ്റും ചില രാജ്യങ്ങളിലൊക്കെ കൃത്യമായിട്ട് ഡോക്യുമെൻറ്റേഷൻ ഉണ്ട്. 2-ൽ കൂടുതൽ കുട്ടികൾ പാടില്ല, അത് കുറ്റകരമാണ് അല്ലെങ്കിൽ ശിക്ഷാർഹമാണ്, അല്ലെങ്കിൽ 3 കുട്ടികളുള്ളവർക്ക് ഗവൺമെൻറ് ജോബ് കിട്ടില്ല. അങ്ങനെ പ്രോപ്പറായിട്ടുള്ള ഡോക്യുമെൻറ്റേഷൻ ഓർ റൂൾസ് ആൻഡ് റെഗുലേഷൻസ്. ഇംപ്ലിസിറ്റ് മീൻസ് ദർ ആർ സം റൂൾസ് ആൻഡ് റെഗുലേഷൻസ്, അത് ഡയറക്റ്റ്ലി അഫക്റ്റ് ചെയ്യുന്നില്ല, വിച്ച് ഈസ് നോട്ട് ഡയറക്റ്റ്ലി അഫക്റ്റിംഗ് into the population growth, but indirectly they are aiming into that. Like for example, a small example we can tell that, like from the third in India we have a rule that the third child onwards there will not be educational allowance. So like central government employees, if they have a third child, the educational allowance of the third child will not be given by government, because the government would try to reduce the population, or they would try to minimize the children number into 2 for each couple. So these are some things, like even that is also a form of a rule, but there are some directives not necessarily issued to influence the population growth and composition, but may have the effect of doing so. Like we can tell some example, they make contraceptions 100% free. See, like you know, some of the countries they have to spend lot of money for getting even one condom, or they have to spend much money for putting one copper T, all these things, or tubectomy, vasectomy, all these procedures. But in India they have made all these things entirely free in public sector. Why? Because it is one of the implicit implicit method of population policy, because അവർ ഇൻഡയറക്റ്റ്ലി പോപ്പുലേഷൻ കൺട്രോൾ ചെയ്യാനാണ് ട്രൈ ചെയ്യുന്നത്. ദേ ആർ നോട്ട് ഡയറക്ട്ലി ടെല്ലിങ് ദാറ്റ്, ഡയറക്ട്ലി മേക്കിംഗ് എനി റൂൾസ്, നിങ്ങൾക്ക് രണ്ടേ പറ്റുള്ളൂ, അല്ലെങ്കിൽ നിങ്ങൾ ജയിലിൽ പോവും, അല്ലെങ്കിൽ നിങ്ങൾക്ക് ഗവൺമെൻറ് ജോബ് കിട്ടില്ല, അങ്ങനെയൊന്നും അവർ ഡയറക്റ്റായിട്ട് പറയുന്നില്ല. ഡയറക്റ്റായിട്ട് പറയുന്നത് for explicit we can tell the example as, like as I have told, in the central government, those who are working there, the third child, they will not get a educational allowance. If they have a third child, for the first and second baby they will get, but if the second one is a twins, then of course the third can get. So these are some rules and regulations. Through documentation, the national government announcing its intention to affect the population growth and composition. Implicit means indirectly, without any rules and regulations, they want to do so. Next is the national socio-demographic goals by 2010. So let us see what are the socio-demographic goals they would like to attain by 2010. So like now we are in 2020, so even by hearing this or by studying this, now we can see what all things they have achieved and what they have not achieved. So what all they had planned during that time is the National Population Policy 2000 has formulated around 14 national socio-demographic goals to be achieved by 2010. You may be thinking, why we are studying this all when we have reached this 2020? Because see, this population policy even have a long-term objective also, which is aiming at 2045. So till 2045 we will be continuously monitoring whether they are able to stabilize the population by 2045. So what all were the 14 socio-demographic goals? Let us see one by one. First one is address the unmet needs for basic reproductive and child health services, supplies and infrastructure. As I have told, they are going to meet the needs of basic facilities for getting reproduction and child health services, especially the supply and infrastructure facilities. The second one is make school education up to the age of 14 free and compulsory for both the genders, and reduce the dropout at primary and secondary school levels to below 20%. See, because government knows that education is one of the main thing in order to reduce the population. അല്ലേ, population control ചെയ്യണമെങ്കിൽ ആളുകൾ നല്ല രീതിയിൽ educated ആയിരിക്കണം. So of course the children from their younger age onwards, they should get the compulsory education, the whole primary or the elementary education made free by the government. 14 വയസ്സ് വരെ കുട്ടികൾക്കെല്ലാം ഫ്രീ എഡ്യൂക്കേഷനും for both men and female, because some states even now nowadays also we can see the scenario that girls or the ladies are meant only for reproduction, without giving any proper education, without sending them to school. They are just being inside the home, and just in the age of 14 or 18 they are getting married without a basic education, and which may lead to early pregnancies, and there is no spacing or gapping between pregnancies. All these things can be reduced only through proper school education. And even secondary school education also, they want to bring down the dropout. What do you mean by dropout? സ്കൂളിൽ പകുതി വെച്ച് പഠനം നിർത്തിപ്പോവുക, അല്ലേ, പകുതി വെച്ച് പഠനം ഉപേക്ഷിക്കുന്നതിനെയാണ് ഡ്രോപ്പ് ഔട്ട് എന്ന് പറയുന്നത്. സോ ദീസ് തിങ്സ് ഷുഡ് ബി റെഡ്യൂസ്ഡ് അറ്റ്ലീസ്റ്റ് ടു ബിലോ 20%. സോ അറ്റ്ലീസ്റ്റ് 80% ഓഫ് ദ ഹോൾ പോപ്പുലേഷൻ, ദ ഹോൾ ചൈൽഡ് പോപ്പുലേഷൻ ഷുഡ് ഗെറ്റ് ഫ്രീ എഡ്യൂക്കേഷൻ. Third one is to reduce the infant mortality rate to below 30 per 1,000 live birth. No need to explain much. These all are the set objectives. So next is to reduce the MMR, maternal mortality rate, to below 100 per lakh live births, then achieve universal immunization against diseases. We have to give much focus and importance on universal immunization. Then promote delayed marriage for girls, not earlier than age of 18. That's what I have told. And preferably, even though the rule is telling minimum 18, we know that in our society or in Kerala, we know that very rarely girls used to get married in this early age by 18. Otherwise, minimum they will be taking marriage at least from 20 to 25. In between this age only, usually they used to get married. Next one is to achieve 80% institutional deliveries and 100% by trained personals. So like at least we cannot tell 100% because they have planned it priorly in order to attain by 2010. As I have told, there are many tribal areas also in India. So like at least they would like to make 80% of institutional deliveries, and around 100% it should be done by a trained personnel. At least if they are taking 20, that minimum balance 20% if they are getting delivered in their home in the rural area or in the tribal area, at least the delivery should be conducted by a trained dai. Then achieve universal information or counseling and services for fertility regulation and contraception with a wide basket of choices. Like already again they are focusing into counseling sections and universal information or services related to fertility regulation. That means the contraceptive methods are more focused here, with a wide basket of choices. Then achieve 100% registration of birth and death, marriage and pregnancy. Then only the country will be able to statistically monitor how they are able to attain the goal, whether they will be able to attain the goal by 2045 at least, or by 2010 at least. So that they have made strengthen the registration system. The 100% of birth, death, marriage and pregnancy should get registered. Nowadays it is very strict in even in the rules also. Control of AIDS and promote their health and prevent the reproductive tract infection and sexually transmitted infections. So they were much focusing on the control of AIDS, reproductive tract infection as well as sexually transmitted infections. Next one is prevention and control of communicable diseases. It was also one of their aim. Then integrate the Indian system of medicine in the provision of reproductive and child health services. We have already studied, they have merged the stream of traditional system of medicine or the Ayush into the public sector also, and even they have attached it along with the RCH2 also. Then promote small family norm to achieve the replacement level of total fertility rate. They would like to promote small family norm, and they want to replace the total fertility rate, like they are maximum they want to try it to 2. Then come together and quality in implementation of related social sector program, so that family welfare becomes a person or people centered program. So like they were telling, you have to the utilization or the quality of the implementation of the social sector programs, like whenever they are conducting some government programs or implementing some social health programs, they would like to make these type of family welfare programs to be much more people centered. Then only, because if there is no we know that the one of the principle of primary health care is community participation. If the people are not participating and the people are not focused, then all these national health programs will not land up in 100% of success. So it should be always people centered programs. So these all were the various 14 goals which they were aiming by 2010. So let us see the process of population policy making. So the various process which they have gone through in the population policy making. First one is developing the constituency in favor of population policy. അല്ലേ, നമ്മുടെ കോൺസ്റ്റിറ്റ്യുവൻസി അല്ലെങ്കിൽ നമ്മുടെ കോൺസ്റ്റിറ്റ്യൂഷനിലുള്ള സെറ്റ് റൂൾസ് ആൻഡ് റെഗുലേഷൻസിനെ പോപ്പുലേഷൻ പോളിസിയുമായിട്ട് ഫേവർ ചെയ്യുന്ന രീതിയിൽ ഡെവലപ്പ് ആക്കിയെടുക്കുക. Then next is identifying the arguments favoring population policy. So whoever is opposing this population policy, we have to identify the various arguments and we have to find out the solution for that, or we have to rationalize that. അല്ലെങ്കിൽ അവർക്ക് വേണ്ട ആൻസർ കൊടുക്കാൻ നമ്മൾ ബാധ്യസ്ഥരാണ്. So we have to identify the various arguments which are favoring population policy. So such type of things should be strengthened. അല്ലേ, എന്തൊക്കെ കാര്യങ്ങളാണ് പോപ്പുലേഷൻ പോളിസി അനിവാര്യമാണ് എന്നുള്ളതിന് നമുക്ക് എവിഡൻസ് ആയിട്ടുള്ളത്, അങ്ങനെയുള്ള ആർഗ്യുമെൻറ്റ്സിനെ അല്ലെങ്കിൽ അതിനെ ഐഡൻറ്റിഫൈ ചെയ്ത് നമ്മളതിനെ ഫേവർ ചെയ്യണം. അഡ്രസ്സിങ് ദ ഇഷ്യൂസ് അറ്റ് ടു എ റൈറ്റ് പ്ലേസ്. So we all know that the rapid increasing population is one of the problem. Which state is having more population? What is the problem of that particular state? Is it because of the lack of literacy? Is it because of the poor women literacy? Is it because of the poor health, or is it because of the early marriage? എന്താണ് ആ സ്ഥലത്തെ പ്രശ്നം എന്ന് മനസ്സിലാക്കിക്കൊണ്ട് കറക്റ്റ് സ്ഥലത്ത് അതിനെ അഡ്രസ്സ് ചെയ്യണം. ദാറ്റ് മീൻസ് ഇറ്റ് ഷുഡ് ബി മെയ്ഡ് ഓർ ഇറ്റ് ഷുഡ് ബി ഡിസ്കസ്ഡ് ഇൻ ദ പ്ലാറ്റ്ഫോം ഓഫ് വേരിയസ് ഗവൺമെൻറ് മീറ്റിംഗ്സ്, എസ്പെഷ്യലി പാർലമെൻറ്റ്, or when they are all the ministers are gathering their health meetings, or in the family and health centers, all these areas they should have addressing these particular issues. Then visualizing the form, visualizing the form a policy should take. So in order to visualize all these things, we have to make a set of policy. So നമ്മൾ എന്ത് കാര്യങ്ങളാണെങ്കിലും അത് എഴുതി ചേർത്താൽ മാത്രമാണ് റൂൾസ് ആൻഡ് റെഗുലേഷൻസ് ആവുകയുള്ളൂ. So we have to visualize all these problems into the form of a policy. Then recognizing the most advantageous time, like we should set a aim, അല്ലേ, അടുത്ത വർഷത്തിനുള്ളിൽ അല്ലെങ്കിൽ 2 വർഷത്തിനുള്ളിൽ അല്ലെങ്കിൽ 10 വർഷത്തിനുള്ളിൽ, അങ്ങനെ നമ്മൾ ഒരു ടൈം പീരീഡ്, ഒരു അഡ്വാൻറ്റേജസ് ആയിട്ടുള്ളൊരു ടൈം റെക്കഗ്നൈസ് ചെയ്ത് ആ ടൈമിലായിരിക്കണം ഈ പോപ്പുലേഷൻ പോളിസി നമ്മൾ സെറ്റ് ചെയ്യേണ്ടതും റേസ് ചെയ്യേണ്ടതും. സോ അങ്ങനെ ഒരു ആവശ്യകത ഉണ്ട് എന്നുള്ളത് ഗവൺമെൻറ്റിന് നമ്മൾ അറിയിക്കണം. അല്ലെങ്കിൽ ഹെൽത്ത് സെക്ടറിലുള്ള എല്ലാവരുടെയും ഒരു എയിമാണ് ഇത് മുകളിലോട്ടുള്ള സെക്ടേഴ്സിൽ സെൻട്രൽ ഗവൺമെൻറ് തലത്തിലോട്ട് ഇതിൻ്റെ ആവശ്യകത അറിയിക്കുക എന്നുള്ളത്. സോ റെക്കഗ്നൈസിങ് ദ മോസ്റ്റ് അഡ്വാൻറ്റേജസ് ടൈം, ആ പർട്ടിക്കുലർ ടൈമിൽ എങ്കിലാണ് അത് ഒരു ടൈംലി ആക്ഷൻ അതിനുണ്ടാവുകയുള്ളൂ. സോ ദീസ് ഓൾ വേർ ദ വേരിയസ് പ്രോസസ് which has been taken for population policy making. Next is the demographic targets of national population policy by 2010. So what were the targets? The first one is enhancing the IEC activities for reproductive tract infections, sexually transmitted infection, or the AIDS to send percentage population. Like എയ്ഡ്സിനെതിരെ അല്ലെങ്കിൽ റിപ്രൊഡക്റ്റീവ് ട്രാക്ട് ഇൻഫെക്ഷനെതിരെ അല്ലെങ്കിൽ സെക്ഷുവലി ട്രാൻസ്മിറ്റഡ് ഡിസീസിനെതിരെ എ മാസ് വൈഡ് ഹെൽത്ത് എഡ്യൂക്കേഷൻ 100% പോപ്പുലേഷനിൽ എത്തിക്കാൻ പറ്റുക എന്നുള്ളതായിരുന്നു അവരുടെ വൺ ടാർഗറ്റ്. നെക്സ്റ്റ് ഈസ് ദ ഇൻ്റഗ്രേറ്റിംഗ് അലോപ്പതി വിത്ത് ദ ഇംഗ്ലീഷ് മെഡിസിൻ ഷുഡ് ബി ഇൻ്റഗ്രേറ്റഡ് വിത്ത് ഇന്ത്യൻ സിസ്റ്റം ഓഫ് മെഡിസിൻ ആയുഷ് ഫോർ ദ ബെറ്റർമെൻറ്റ് ഓഫ് റീപ്രൊഡക്റ്റീവ് ആൻഡ് ചൈൽഡ് ഹെൽത്ത് സർവീസസ്. നെക്സ്റ്റ് ഈസ് എൻകറേജിംഗ് ദ ഫാമിലി സ്മോൾ ഫാമിലി നോം ടു substantiate reduction in total fertility rate. Next is coordinating the activities of social sector development to make family welfare program public oriented. These all things already we have seen in the objectives, but just in a short form or in a as a target form they have given. That's all. Next is fulfilling the unmet need for reproductive and child health, free and compulsory education for children under 14, reducing the school dropout between boys and girls to 20%. Then bringing the IMR less than 30 per 1000 live birth, bringing the maternal mortality rate less than 100 per 1 lakh live birth. Then increasing the immunization against all the communicable diseases to 100%. We should make it the coverage of immunization. Then encouraging the increase in average age at the marriage age of the girl should be increased to an average level. Then increasing the institutional deliveries at least to 80%. All should be able to get delivered in institutions like at least public sector, at least in a PHC or in a CHC. Then delivery at least it should be, even though the other balance 20%, if it is taking place in home in the tribal areas or in the hilly area, it should be conducted by a trained personnel, and making contraceptive choice, a wide range of choice to be adopted by 100% by the population. The strategies for National Population Policy 2000 India was, first one is decentralize the plan and program implementation. Decentralizing the plan and program. What is decentralization? From the central government, it should be able to reach the periphery, that means even the village grassroots level, like from the central government, state government, district government, then blocks, panchayat, town, city, so urban, rural, everywhere to the periphery, till the periphery, it should be able to decentralize the program, even the implementation part also. Then convergence in services at delivery points. So all the services should be able to get at the delivery points, and it should be able to coordinate by all the sectors. Then empowering women for improved health and nutrition. We have to empower the women. Women health should be empowerment of women. Already we are studying in this year. So I hope we all know what is empowering the women. So in order to empower the women, the first thing is to improve her health and her nutritional status. Then strengthening the child survival, improving the child survival, especially through proper immunization, proper nutrition, proper exclusive breastfeeding. All these things should be motivated. And meeting the unmet needs of family welfare. Then special services for slums, especially in the slum area we should be able to provide special services. Then attending the adolescents, because adolescent age group they attain the menarche, and many of them they go to anemic status because they used to do some unwanted type of dieting during that particular age. Otherwise in the area where there is a rural slum or economically very backward during that period, actually girls they go for work during that particular age, or due to menarche, if they are not getting proper nutritious diet, they may land up in so much of issues. So attending all these problem, nutritional issues, or their depression issues, or their menarche issues, their body change issues, all these things of an adolescent should be taken care. Then increasing male participation. So male participation is also very very important, especially in order to control the population. Not only the female should be highly educated, the males also has a major part in that. So the males also should be highly educated, and they also should be able to increase the participation into this particular program. And the mainstreaming of Indian system of medicine and homeopathy into the stream. Then providing care for old age population. Then mass education, information education and communication, IEC activities. Then promoting the small family norms, family welfare, should be more people centered program. All these things were very very important. Then the structures to be created for national population policy by 2000. So the National Population Commission under the chair of Prime Minister, that was one structure. The next one is Population Commission in each state under the chair of chief ministers. That's what I told, not only in the central level, in the state level also it is having so much of structures or branches. Then coordination cell in planning commission at country level, and creating technology mission at national level. So these all were the various structures which really created the national population policy. So I hope you have understood what I have taken today. See, in this it is a very small program. The word itself really indicate you what is the aim. They are looking for the reduction in the population, or they want to reduce the total fertility rate. They want to focus upon small family norm. They want to improve the mortality or the morbidity rates of children, as well as the reproductive age group, and as well as the mothers. So these all things, the 14 points you should remember. If you know the 14 points very well, you can answer it very nicely if it is asked for a 5 mark. So I hope you all have understood. It is well clearly given in KPAR textbook. No need to write any of the notes of this. Please follow the textbook KPAR so that you will be able to understand much more. Thank you all.